So, folks, we're in the last 20 minutes, and it's the highlight of the conference in that we're going to quickly canter through our annual awards. As ever, they were hugely competitive and a very tough field. And we've got some extra awards this year. For example, one on public and patient involvement and engagement. So that's a new award, and we're looking for examples of PPIE in terms of research, the development of research infrastructure, as well as service development. So I'm going to try and announce these awards with great aplomb, and please imagine a lot of applause in the background. These wouldn't be possible unless we had the panelists and the chair of the panel, which had a predominant early career researcher focus under the leadership of Holly Dawn. So just to thank Holly Dawn. So thank you to the chairs and the panelists for their great enthusiasm. So the prizes are absolutely wonderful. So each will receive, I'll just read these, a professional case study by a science writer, professional training and development course of the winner's choice, in a destination of choice, and rocket books. So there's a whole package of sort of prizes here. And usually I do buy everyone a drink at the end of the day. So I can't do that today, but I will definitely double up next year. So we're going to see if this works. The first award wasn't the lightning talk session the best session of the day. I thought it was. So can I congratulate the 6 speakers if we can get the first slide up? Okay. Oh, I just got rid of it. Apologies. Well, we had an all-female lineup. All gave great presentations today, and they were the highlight of the day. And the winner is Sarah Khalid, who is a senior research fellow in biomedical data science at the University of Oxford, who gave a fantastic talk on ethnicity, equity, and AI, and enabling a new approach within the national trusted research environment, which will benefit a multitude of other research projects. So all credit to you, Sarah. We'll now move on to the team of the year. As you know, we're really keen to celebrate team science at scale. If we can get the nominations up, I would like to acknowledge the shortlist, who were, next slide, the MumPredict team, the Eve 2 team, and the UK HSA Siren team. So some fantastic 2 COVID nominations, 1 non-COVID nomination. And I'm delighted to announce the winner, which of course this year is, next slide please, it is MumPredict. So this is an amazing consortium of 8 universities from all 4 UK nations, with interdisciplinary and multidisciplinary participation, data scientists, clinicians, primary care, public health, but a very strong patient and public representation. As you can see, we almost couldn't get all the names on the slide. It was such a great team effort, which was very inclusive. So well done to the MumPredict team. So we'll now very rapidly move on to the Impact of the Year award. Again, this was hotly contested. If we can get the next slide up. So we're very keen to translate beyond the academic publication. And the 3 shortlisted awards were the economic analysis of intermittent versus continuous cetuximab in KRAS wild-type patients with metastatic colorectal cancer. Secondly, the Data and Connectivity National Core Study, which engaged colleagues across the UK. And lastly, the association of COVID-19 with major arterial and venous thrombotic diseases. Each of these has had a major effect on NHS systems at scale or policymakers. And I'm delighted to announce the winner is, next slide please, the economic analysis of intermittent versus continuous cetuximab in KRAS wild-type patients with metastatic colorectal cancer. So Raymond Henderson and team, congratulations. And the key issue that the panel applauded was the work's translation into policy in a very, very short time frame. This notion of non-COVID related translation in an expeditious way is very important. We now move on to the Public and Patient Involvement and Engagement Award. As you know, this is core to our mission. We want the views, ideas, and leadership of patients and public to be embedded in everything we do. And this award celebrates best practice and innovation. So can we again thank everyone who's submitted nominations. We had scores of nominations, and the 3 shortlisted awards are MumPredict Gut Reaction, a data research hub in partnership with the NIHR Bioresource, and Pioneer, another data research hub. And I'm delighted to announce the winner, which is Gut Reaction, because of the fantastic partnership with Crohn's and Colitis UK, the embedding of public engagement every step of the way was just remarkable. And Gut Reaction is now a well-established data resource supporting patient-related research in inflammatory bowel disease and beyond. So all credit to Gut Reaction. And finally, we are going to introduce the concept of recognitions. What we're seeking to do is to recognize good practice and reproducibility and celebrate hidden roles, unsung heroes across this partnership of health data science. Reproducibility is key to that because that's central to the research effort and open science, and therefore we're seeking to acknowledge the commitment to reproducibility and also to the publication of open methods, fair data, open source software, use of DOIs, and registered reports. So if we get the slide up, the recognition award has 3 shortlisted candidates. We've got a lot more. We've got 6. We've got CoConnect, we've got HDR UK Text Analytics, Phenotype Library, PAMAPI, RADAR Base, and then the CVD consortium. And the winner of this award is, we'll have the next slide. All right, okay. So we are actually going to give them all a prize because it would appear our prize budget will allow that. So they are all going to be awarded a prize. But I would like to finally acknowledge and congratulate the so-called unsung heroes or hidden role recipients who represent the diversity of health data science, including program managers, administrative staff, PPI leads, technologists, and more. And they are Erin Massoud, Jenny Johnson, Joe Bess, Letitia Pele, Vicky Hammersley, Natalia Riglinska, Matulyev, Lana Woodward, Alexander Vitoch, Aditya Achari, Krishna Gokal, Mega Singh, Yuangan Lee, Rachel Plashinsky, and Nagawi Moss. And apologies if I have got any pronunciations slightly wrong. But can I, on behalf of the whole community, thank you for your commitment, leadership, and immense contribution to everything that we do. That was a slightly different awards ceremony. I understand there's lots of applause on the platform, which is great. But what we should do when we do meet in person is do this all again, because it's slightly abstract and we're really acknowledging people's immense commitment, contribution, and commitment to our values. So thank you. So I think it is now my job to summarize what I think has been a wonderful day. We wanted this conference, both in person and remotely, to be provocative, to shake up thinking, to look at key issues with a different lens, and to push the boundaries. And I think we have evidence today that we've done that from the very first presentation from Ken Kukyu in terms of reframing how we address the trustworthy use of health data. He introduced the concept of a data duty of care. And if we get this right with public engagement, he suggested it can inspire people's lived experiences. And I think that phrase captures, it underpins what we're trying to do as a broad UK and global community, as we are public servants, and we want to harness the potential of health data in a trustworthy way. And perhaps this reframing will be helpful. We've looked at some key issues, and I tried to attend all the sessions. The session on equality, diversity, and equity of health data to ensure we leave nobody behind. And the phrase in that session, which resonated with me, we need to be inclusive of seldom heard populations. On the technical side, I thought John Gallagher chaired a wonderful session on the safeguards of the 5 safes and the next generation of trusted research environments. And a quote from John Halamka suggested we've got a lot of communication and explaining and discussion to have. He said initially at the Mayo Clinic, colleagues said, we don't like the cloud because you can't lock it up at night. So explaining the safeguards, the privacy enhancing technology that these next generation environments create is important. I thought the lightning talks were absolutely fantastic. And can I just again shout out Hadley, Hannah, Anuradha, Sarah, Marta, Yasmin, and Holly Dawn for doing all the heavy lifting, and Utkarsh for being a fantastic chair. I thought that session was just wonderful. Then in the afternoon, we talked about diversity of data, absolutely essential if we're going to understand the broader determinants of health. And as Tim Ferriss suggested, population health, where we need to understand the environmental, the education, housing, and transport variables that influence health outcomes. And finally, in the parallel session, we had a great session on how do we learn from COVID so that we don't regress to where we were pre-pandemic, but take the best of COVID and apply it to non-COVID related harm, whether it's heart disease, cancer, lung disease at scale. And then we finished with a global outlook. Can I thank Trudy and Maurizio? We have so much to learn from colleagues in Brazil, in Africa, and Southeast Asia. And if we develop this reciprocity that Trudy talked about, we will accelerate the application and the understanding of health data science at scale in a much, much better and a much expeditious way. And lastly, Tim Ferriss, I think, outlined that there isn't a plan B, that we have a duty to work together at scale to try to improve the triple aims of health services through the application of data science and innovation. The triple aim of improving the quality of care, improving health outcomes, whereas lowering cost of service provision. So I think we've had an absolutely outstanding day. To finally just quote three sentences I've heard today. We've, in the chat, someone very thoughtfully pasted a quote from Sir Austin Bradford Smith: "Health statistics represent people with the tears wiped off." We should never, never forget that. Secondly, Mary De Silva, quite rightly in her session, we said what we must celebrate what we have learned from COVID and apply it to business as usual so that we make it better. And finally, to use a quote that John Gallagher said, this is the future. Our responsibility is to make it a good future. And I would echo that we will only make it a good future if we demonstrate trustworthiness and involve and engage our patients, the public, citizens of the UK internationally, every step of the way. So at precisely 16:57, I'm going to give you 3 minutes of your day back. Most importantly, can I thank one or two people before I do that? Firstly, our fantastic speakers. There were 32 of us. Some of us joined at crazy times. It was 4 a.m. in the States when John Halamka joined us. Tim Ferriss was always in the States, and also Dorcas from Kenya. Secondly, our organizing committee, who worked hard and produced a fantastic program chaired by Cheryl and Nina. Other committee members are Helen, Mandy, Ian, and Sarah. Our event crew, they pivoted to a virtual event with virtually no notice. Verinda, Amanda, Alice, Holly Dawn, Sam Blake, Ruby, Ros Walker, and Kate McAllister. And finally, our production team, Paul, Steph, and Alex from London Film. But most importantly, can I thank you for your participation, your engagement, and your commitment to make lives better. So on behalf of us all, a huge thank you, and we will see you next year, hopefully in person. So goodbye and happy Christmas.